everyone, so let's move towards our today's topic, which is
tubular reabsorption part 2. We have discussed in the part 1 that what is transportation, how the transportation occurs, and we have discussed the overview of the renal tubular reabsorption. But in this lecture we will start by like step by step के proximal tubule में क्या हो रहा है, loop of Henle में क्या हो रहा है, distal tubule में क्या हो रहा है, and so on. First starting from the proximal tubule, because proximal tubule is continuous with the Bowman's capsule. We all know glomerular filtration में filter हो रहा है blood, जो भी चीज़ें हैं वो आ रही हैं Bowman's capsule में, that is called as glomerular filtrate. That glomerular filtrate is entered into the proximal tubule. Now in the proximal tubule there is a reabsorption of sodium through through active transport, and same like that, like I said, sodium and glucose will transport together. That is called as sodium glucose co-transporter. Okay, and at the same point in the proximal tubule there is another transporter for hydrogen. Okay, because hydrogen is secreted into the renal tubule because if I talk about acidosis, so what happened in acidosis? Hydrogen ion will be if I am not wrong, yes, hydrogen ion will be excess in our body. So if hydrogen ion in our body is if there is an excess of hydrogen ion in our body, that is called as acidosis. In acidosis condition, what you have to know, what the kidney do, basically the proximal tubule will secrete the hydrogen into the tubule, so that from tubule they will enter into they will form urine and they will excrete it out of the body. ठीक है. Now proximal tubule is further divided into two parts, two halves. First half and the second half. First half is basically for reabsorption of sodium along with amino acid and glucose, whereas in the second part reabsorption of chloride take place. Okay, now if there is an absorption of sodium along with the amino acid, that is called as sodium amino acid co-transporter, that is occurring in the first half. In the first half there is another co-transporter, that is sodium glucose co-transporter, which transport the sodium along with the glucose. Okay, in the second half of the proximal tubule, basically what happens, sodium chloride co-transporter is present, which transport the chloride along with the sodium, because what happens, sodium to transport होना ही है, तो chloride उसके साथ मिलकर उससे दोस्ती करके basically they will form a friendship between basically friendship will occur between sodium and chloride, and that will be transported. Okay, for understanding purpose you can understand this thing, you can memorize this thing. Now moving further, after proximal tubule is continuous with the loop of Henle. Loop of Henle consists of three parts. Okay, in some books you can say that it is divided into two parts, but actually it is divided into two parts, ascending part and descending part. Ascending part is further divided into two parts. The lower part is thin walled, that's why that is called as thin ascending part, or the thin segment of the ascending part, and the upper part of the ascending upper area of the ascending part is basically called as thick segment of ascending part, because the walls are very thick. Now first we will talk about descending part. In descending part there is a reabsorption of water and solutes. Okay, and if I talk about the thin, you have to know that in which part what reabsorption is taking place. So in descending part, water, urea and sodium, the reabsorption of water, urea and sodium will take place. If I talk about the thin segment of the ascending part, they help in reabsorption of water and other solutes. Okay, majority of the water will be reabsorbed in the loop of Henle through descending part. Okay, a little bit of water will be reabsorbed by thin segment of ascending part or the lower segment of the ascending part. But if I talk about the thick segment or the upper segment of the ascending part, that segment will not reabsorb water. That will only take place, they will only help in the reabsorption of sodium, potassium and chloride, because the thick, basically what happened, this point is very important. The thick segment of the ascending part consists of a transporter that is called as sodium potassium chloride transporter. Sorry, that transport is called as 1 sodium 2 chloride and 1 potassium co-transporter. Basically this transporter will transport 1 sodium, that's why it is called as 1 sodium 2 chloride and 1 potassium. Why it is called as 1 sodium 2 chloride and 1 potassium? Because they are transporting 1 sodium 2 chloride ions and 1 potassium ion. That's very simple. Okay, so that's why we can say that no water will be reabsorbed in the thick part or the upper part of the ascending part. Okay, thick segment of the ascending part. One more thing, when acidosis occur or alkalosis will occur in our body, there is a sodium hydrogen co-transporter in this part, in the thick part of the ascending part, so that hydrogen will be excreted out of the body. Now moving more further, reabsorption in distal tubule. What happened in the distal tubule? Basically, along with the distal tubule we will discuss cortical collecting tubule as well. Why? Because their functions are a little bit similar. We will discuss. First thing which you have to remember, that distal tubule is divided into two halves, first half and second half. The proximal tubule and the distal tubule both are divided into first half and the second half. Like I said, distal tubule is divided into first half and the second half. First half is same in function, same the function of the first half is same like ascending part, the thick part of the ascending part, which reabsorbs sodium, chloride and potassium. Okay, and no water will be reabsorbed in the in this part, that is first half of the distal tubule. In the first half of the distal tubule no water will be reabsorbed. Okay, in the second half of the distal tubule, that second half of the distal tubule and the cortical collecting tubule, okay, the second half of the distal tubule and the cortical collecting tubule both are similar in function. That's why we will discuss this thing together in the next part. Okay, till then what you have to know, what you have to do is work hard, study hard, and good luck. Take care. Remember me in your prayers. Bye bye. Thank you.